Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. We all work then to support the timing of the need for the release provider. It's a delicate balance that is very individualized. My hope is that you, as a professional, have a team in your neighborhood that works as well as mine does. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hello, everyone, and welcome back to another episode of the Tongue Tie Experts podcast. I am your host, Lisa Paladino, a nurse, a midwife, and a lactation consultant. Today, we're diving into a crucial topic, the team approach to tongue tie. It's something I'm passionate about because, sadly, many parents and babies are not getting the help they need to reach their feeding goals. The problem is that too many professionals or quote-unquote social media experts are telling parents to have the tongue tie fixed without being sure that the tongue tie is the problem creating breastfeeding difficulty. Too many babies are having surgery without a functional evaluation. Adding to this, often the quick fix expected with a snip or a laser doesn't help the dyad to meet their breastfeeding goals. A little aside, in real life, away from babies, breastfeeding, and tongue tie, I'm a crazy baseball fan. Don't hold it against me. I waste more time watching the New York Mets than I should, but it's my lifetime love thanks to my dad. I've learned some principles about teamwork from this crazy obsession. And these things translate to my work with tongue-tied babies. Bear with me as I try to explain. I have learned that there is no I in team. Giving up the ego to be the most important player is never good for the team or the desired outcome. Winning teams have input from all players, and some situations require more input from different team members. Same with tongue tie assessment. Diagnosis, treatment, and recovery all need a team. Team players on my tongue tie team include body workers, also known as manual therapists, such as chiropractors, physical therapists, occupational therapists, craniosacral therapists, osteopaths, etc. Release providers, which could be a dentist, could be a doctor, could be a nurse practitioner. In some places, it's a nurse, depending on your scope and where you are. And feeding therapists or speech language pathologists with feeding as their priority and training, and others like myself, IBCLC or other CLCs. Of course, the birth providers are included and doulas especially. So doulas, midwives, doctors. And why I say doulas especially, don't get upset, midwives. I'm a midwife too. But the doula is the one who's spending the more time usually before and after with the baby and the mom, helping them settle into their new role. So sometimes my role as lactation consultant is the most important on the team, but other times it has to be the manual therapist first and foremost. Often I recognize that the feeding dysfunction is beyond my scope or skill, and I'll send directly to the SLP. We all work then to support the timing of the need for the release provider. It's a delicate balance that is very individualized. My hope is that you, as a professional, have a team in your neighborhood that works as well as mine does, and that the team you root for in baseball is less frustrating than my New York Mets. No offense, Mets guys, but it's not easy to be a fan of that team. Anyway, if you'd like to learn more about building and finding other professionals to network with, there will be so much more about this in the new Professional's Guide to Tongue Tie. You can sign up for updates at tonguetieexperts.net/pro course. In today's episode, we'll discuss the team approach to tongue tie. In other sessions, you'll hear stories of families who went directly to a provider for frenotomy or the procedure to release the restriction and found that things did not improve. This is because without a comprehensive team approach, addressing all aspects of feeding, both parent and baby can continue to struggle. Now, I know what I'm going to describe here is an ideal approach and one that may not be available to all families and providers. But I believe it's important to have a standard of care to strive for and to make adjustments when necessary. If you're a parent who had a baby with tongue or lip tie and didn't have the awareness or opportunity to use a team approach, please don't feel badly about it. If you're a professional who has been working in a vacuum and not referring or getting referrals from other providers, same. Don't feel badly about it. Remember Maya Angelou's wise words. We do the best you can until you know better. Then when you know better, you do better. I preach the TOTS team approach. TOTS stands for tethered oral tissues, which includes lip ties, tongue ties, and other oral restrictions. In my practice, we use this team approach to individualize care based on the baby's function and how feeding is going for both the parent and the baby. I'm going to now go through the team members and describe their roles. So an IBCLC, or International Board Certified Lactation Consultant, is generally the team leader. They have the highest level of lactation certification available and are trained to assess complex lactation issues and examine the mouth. An IBCLC can evaluate both the parent and the infant to determine if the tongue tie is causing the breastfeeding concerns or if there is another issue, especially in the mom. Issues such as low milk supply, lack of education about how to manage breastfeeding, even inability to know the best positions for breastfeeding must be evaluated by the expert on lactation, which is the IBCLC. Next on the team, and this is not in any particular order, I just listed them out, what we call body workers or manual therapists. And these include professionals who practice techniques involving touch, massage, manipulation, and or energetic principles for health improvement. This can include chiropractors, osteopaths, cranial sacral therapists, occupational therapists, physical therapists, massage therapists. Hope I'm not forgetting anyone. These professionals help the baby's body relax and function more effectively, addressing tightness in muscles or fascia that might hinder comfortable and functional movement. Also, often a comorbidity or mimicking situation, mimicking diagnosis to what appears to be tongue tie could be torticollis. And we need the manual therapist to assess for torticollis and treat it or help guide treatment for that baby's ability to move from side to side, to turn their head equally from side to side, and move all the muscles in the face, head, and neck and mouth with the same ability. So that's what we need those important team members for. Then we have speech language pathologists, SLPs, or feeding therapists, and they are indispensable for infants with oral problems that lactation consultants cannot solve. They help infants who can't feed efficiently, who can't take a bottle, or have tone issues in the face or mouth. Their expertise in oral motor function is critical for comprehensive care. I value the SLPs on my team immensely. I could not do what I do, and they can't do what they do without me. Vice versa, right? We're a team. And we did not learn together. We do not learn together. And our disciplines rarely meet to learn in the same place, which is why I love this field. And I love teaching my course where there are lots of speech language pathologists coming to learn the lactation side of things and learning how we can all speak the same language so that we can help these mothers and babies. Okay. Who else do we need on the team? We need a medical provider for the procedure, right? So this could be a medical or a dental provider. It might be a dentist. It might be a midwife, an NP. I feel that it's preferably, if available, someone experienced with laser release. But there are some people who do amazing scissor release. But it's essential to seek out an expert for frenotomy. Typically, at least in my area, it's a pediatric dentist with specialized training to ensure the procedure is done correctly. So how does this work in practice, right? What's the flow here? And again, this is in an ideal world. In my ideal world, the tongue tie would be discovered by the OB team or the pediatrician. And it could be an OB or a midwife, a pediatrician, a doula. Somebody says this baby is not nursing right. This could be a tongue tie. But actually, in practice, many parents come to me either suspecting a tie for themselves or for other breastfeeding concerns, having no idea about tongue tie. So how it typically unfolds is I assess the parent and baby to develop a care plan. And this involves a lot of things, but evaluating the baby's latch, the feeding behavior, the parent's breastfeeding experience, etc. And if you want to learn my complete assessment process, it's going to be in the course, but I've done some other episodes about that, including Beyond the Mouth, which is an episode that will precede this episode. You can look for that. Okay, so referral to body workers. So that comes next, depending on the case. Although sometimes I get a referral from a body worker, right? So it can go either way. But if they've come to me first, I say, okay, before we consider frenotomy, I think you should go to this person or that person. And I give a referral list that gives the family options for which type of provider they're most comfortable with and or can afford and or is in their best geographic location, right? We want this to be easy. So, there may be someone who feels comfortable with chiropractic. There are a lot of people who don't feel comfortable with chiropractic. In my experience, I am extremely comfortable with chiropractic because I've been seeing a chiropractor since I was a kid. My parents always took me to the chiropractor, and I have providers in my area who are very experienced and very professional in treating babies and mamas, right? So, but others ideas are physical therapists or occupational therapists or craniosacral therapists, and I evaluate and guide the family towards the type of provider that feels the best for them, right? This is always about education, not about telling a family what to do. It's just about, here's what I think, here's what this person does, here's what that person does, here's where their office is, call them and find out, right? But what's wonderful is once they have picked their other providers, the other team members, we usually get permission to collaborate or talk to each other about that patient and together decide the plan of care, sometimes in collaboration with the parents, or determining whether or not the frenotomy is needed, and determining the timing of the frenotomy. Like, you know what? I need another week for mom to work on her milk supply while you do tell parents to do this and that and the other thing with, exercise wise, positionally wise with the baby. And then we'll come together and see if the baby is ready. We want the baby to be ready. We want the family to be ready, right? And then the procedure happens, and I have lots of other episodes. I won't go into the procedure because that could be hours. We do a deep dive. A whole module in the professionals course is about the procedure, different types of procedures, preparing for the procedure, how to know we're ready for the procedure, how to guide families through the procedure, etc. After procedure, post-frenotomy care includes collaboration with the IBCLC and the other team members, or the SLP and the other team members, depending on the age of the baby or child, or what the conditions were that we were trying to fix in collaboration with fixing the tongue tie. So if it was torticollis, maybe she's working with a physical therapist and the torticollis improves after the tongue tie release, but we have to keep that care going. We don't just say, okay, it's done and walk away. So this model, this teamwork model, is comprehensive, and it ensures that all aspects of feeding and health are addressed. It's not just about the procedure, but about ensuring the baby's body is functioning optimally, and that the parent is supported throughout the process. It's also crucial to address the emotional and mental health of the parent. Many parents experience anxiety, depression, or feelings of inadequacy during this challenging time. Support, screening, and referrals to mental health professionals can make a significant difference. So, in conclusion, now that I've explained how the team approach to tongue tie treatment works, what do you think? Did it clear up any misconceptions? Any aha moments for you? Feel free to either comment below if you're watching this live video, or send me an email with your thoughts, lisa@lisapaladino.net. Tongue tie treatment can be complex. Those who expect relief with just a quick snip or laser release, even by an experienced provider, are often disappointed. A comprehensive team approach ensures that both the parent and baby receive the necessary support to overcome feeding challenges and achieve their feeding goals. Thank you for joining me today. I hope this session has provided you with valuable insights into the importance of a team, and stay tuned for more discussions and stories for future episodes. Until next time, take care. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.